Hello, students. Good morning. Good morning. How are you, people? Hello. Hello, students. Good morning. Good morning. Good morning. Okay. So today we are going to discuss about a few protozoal diseases and then fungal disease and if time permits, AIDS and cancer. Okay. So let's start. So here it is classification of protozoans. Okay. Protozoans are classified into 4 groups. Classification of protozoa is not important here. Exactly which protozoans they are responsible for disease, or mainly which group is responsible for the disease causing to human, that I want to discuss here. So exactly this classification table, this diversification table, it is not very important, but just I want to have to say that which group of protozoans, because protozoa is a big group. So from which group of the protozoans, yes, infection chances are the more and more. For example, here you see the yellow words, yellow headings. Flagellata, mastigophora, one group. So with flagella containing protozoans called flagellata or mastigophora. The word mastiga means whip, W-H-I-P, whip. Whip means the one straight filament like structure, and that's why it is called mastigophora. Mastigophoras are flagellata, two different names. Then go to Sarcotina or Rhizopoda. Amoeba comes under this group. Amoeba proteus or amoeboids, they come under this group. Then go to ciliata. Yes, protozoans with cilia called ciliata. Then go to the sporozoa. Sporozoa, maximum members are parasites, or maximum members are going to be disease causing organism. Yes, here the last one, last group is going to be disease causing organism. Sporozoa. Sporozoa, here you'll get locomotory structure, reproduction pattern, you'll get dependency, whether they are free living or parasitic. Okay, the body, it is covered with what, and a few members and diseases, not all members. Okay, few members and they have the disease what they are causing. Here you come. I think this is speed. Okay, you are understanding, everyone? Here what I'll highlight, just you can note it down or you can take the screenshot, that will be your notes. Okay, everyone. So I'll highlight what it is required. Okay. So here you come. In the group of flagellata, trichonympha, it is free living, non-parasitic. So I'll not highlight because human health and disease we are discussing. Okay, Trichomonas vaginalis. Yes, this is in your syllabus. Okay, this is in your syllabus. Trichomonas vaginalis. It causes trichomoniasis. Then go to Leishmania. It causes leishmaniasis or Kala Azar. Kala Azar, one of you are asking in the first day of infectious disease we are discussing. So Kala Azar is caused by. So these two examples here, that much. Then go to Inter-amoeba histolytica. Inter-amoeba histolytica, upper example, first one, this one. It causes amoebic dysentery. It belongs to which group? Sarcotina or Rhizopoda group. Then one more member, E. gingivalis. E. gingivalis, what you can see, Inter-amoeba gingivalis. Gingiva. Gingiva means your gums. Okay, and gums infection, it is caused by the Inter-amoeba gingivalis, called gingivitis. Infection of inflammation of gingiva is called gingivitis. Okay, you can take the screenshot and then you can zoom. If I'll zoom to other examples, it will not be visible. Okay, so wait, then leave this one, go to this one directly. This one causes the 4 species. Can you see 4 blue lines? All these are responsible for malaria. Plasmodium vivax. I'm reading. Okay, you can take screenshot, you can zoom it. Wait, listen. Okay, Plasmodium vivax, Plasmodium falciparum, Plasmodium ovale, Plasmodium malariae. Okay, these are required. So first you take the screenshot. Everyone, screenshot done? Take the screenshot. Yes, done. Now here you can read. I'll zoom out, zoom in. So here's Leishmania donovani causes leishmaniasis or dum-dum fever or kala azar. Okay, then go to Trichomonas vaginalis. It causes vaginal infection. That's why I call it trichomoniasis. Okay, trichomoniasis is due to Trichomonas vaginalis. Trichomonas tenax not required. Trichomonas tenax not required. So these two done. I think done. Then go to one example here, Inta-amoeba histolytica. Inta-amoeba histolytica. Inta-amoeba histolytica. This is done. Inta-amoeba. Gingivalis, gingiva infection, not very important. This one is very, very important. This one here. So here 4 species, same genus. Plasmodium vivax, Plasmodium malariae, Plasmodium ovale, Plasmodium malariae, falciparum. This one causes the most dangerous malaria or brain malaria. This is the most fatal one, most dangerous malaria. Which among the following is the most dangerous one or most fatal one? It causes the fatal malaria. Means fatal means here deadly malaria. More malignant form of malaria. Malignant means what? It is the more here dangerous. Fatal malaria. Okay, Plasmodium vivax is the most common one. Easy, I think. Noted. Now I'll explain in detail malaria. In detail, malaria we are going to discuss. I think this is done. Pace okay, speed okay. Here you can see Inta-amoeba Inta-amoeba histolytica under microscope, how it looks like. Inta-amoeba histolytica, this is the under microscope photograph of Inta-amoeba histolytica. Rhizopoda, already we discussed habitat. It's an endoparasite. When parasites, they live inside body, they are called endoparasites. Okay. Syllabus for the test. Syllabus for the test, what it is taught in this week, and soon it will be updated to you. In this week, what it is taught to you from zoology, yes, it will be in your syllabus. Okay, simple things, don't worry. Class Rhizopoda, habitat trophic level, where they live inside body. That's why I call endoparasite. Endoparasite means inside body. Suppose I am saying ectoparasite. Ectoparasite means okay, what it lives on body, on surface of body. For example, body louse. Body lice, louse, it is the ectoparasite. Okay, leech is ectoparasite. Okay, disease, amoebic dysentery. Amoebic dysentery. This part you leave it. Okay, monogenetic and dimorphic, you will not understand in detail. So just remember what disease and pathogen name. Disease and pathogen name done. Now we are going to discuss directly to malaria. Okay, to understand malaria, you need to understand which mosquito bite it is responsible for malaria. So Anopheles mosquito. Why Anopheles? Last class also we discussed parasites are generally species specific. Okay, not other species of mosquitoes and not other species of mammals also. Remember, yes, mosquitoes may bite to take blood from other mammals, but malaria, it spreads to not all mammals. You will not get the malaria in cow, but yes, mosquito bite, it is found in cow also. Mosquitoes, they bite too, they suck blood from other mammals also. My point is, why malaria it spreads only in human? Okay, answer is parasites are species specific. Parasites are species specific. Very good. Come back to this Hepta. First, if I'll say, I'll use different images to explain same thing. So your attention required here, everyone. This is the part of mosquito body. Here, this area is part of mosquito body. This is the part of mosquito body, and this is human body. In mosquito's body, what it happens, we'll discuss. In human body, what it happens, we'll discuss. Okay, chalo, let's start. When infected female mosquito, infected female Anopheles mosquito, okay, used to bite us human, okay, it used to inject sporozoid stage of malaria or plasmodium. It infects or it injects what the stage? Which stage? Sporozoid stage. Sporozoid stage. Sporozoid stage, rice grain like stages. Here you can see rice grain like these stages. They enter into human body. So infective stage to human, if it is asked, infective stage to human, which stage is infective stage? For human, you have to say answer is sporozoid. So first point to note down, in human, what is the infective stage? Sporozoid. Yes, doubts say. Pujita V, yes, faster, your doubts. Pujita, yes, type your doubt fast. Quick, Pujita, I'm waiting for your doubt. Yes, anyone? Yes, Pujita, your doubt. Okay, I think. Hello. So Hepta, protozoa. Protozoa, which form of protozoa? Plasmodium. Plasmodium, which stays sporozoid, enter into human body. Plasmodium, sporozoid, enter into human body. So malaria disease, decreases platelet number, right, sir? No. Dragon, Basrikta, you are not on track. Last class we discussed about dengue disease. In dengue platelet count decreases. It is not related to platelet count. Listen to class carefully. Okay, if you listen, yes, each and everything I'm saying in class if you're not listening to yes Ravi's question you'll ask, please focus here okay. Sporozoids They are infective stage. It will be asked in your exam. What is the infective stage for human in case of malaria disease? Done. Complete. This sporozoid enters into liver. Okay, liver cells are called hepatocytes. Liver is hepatic organ and liver cells are called hepatocytes. So when sporozoid infects liver cells, so how it reaches your liver? Through blood. Through blood it reaches your liver area, and there it enters into, infects into the hepatocytes, liver cells. So liver cells, after infection, liver cells, they release huge number of merozoites. So you need to remember second stage is merozoite. It is in your board exam in detail. So yes, important for your syllabus, very very important. Listen carefully. Merozoites, now they'll enter into RBC. So first mosquito gives sporozoid. Sporozoid enters into liver cells, hepatocytes. Hepatocytes further, everyone, hepatocytes further, after infection they release another stage, merozoid. Can you see all these stages, these structures? These are called merozoites. Merozoites, they'll enter into RBC. So they infect your RBC, and this second cycle, this is first cycle, second cycle. In second cycle, your RBC, it will be destroyed. RBC, it will be destroyed. So when RBC it is destroyed by merozoite, one toxin it is formed, hemozoin. This hemozoin toxin, it gives fever, chills of that high grade fever to you. It is all due to breakdown of the RBC and hemozoin toxin production in human body. Here only due to infection of merozoite, toxins are formed. Due to infection of merozoites, toxins are formed in RBC called hemozoin. Hemozoin. Okay, I think this is done. RBC meaning clear here. Then you go to after RBC, in RBC cycle, it forms gametocytes. Gametocytes are not gametes. Gametocytes are before gamete structure. Means these gametocytes, they'll form gamete, sperm and ova, or female gamete and male gamete of the plasmodium. So these structures, hepatic means liver, hepatic cells means liver cells. Yes, correct. Yes, Pranav, correct. So here again, so these are what the gametocytes of the plasmodium, Plasmodium falciparum, you can see here different gametes. Again mosquito bite. Suppose the infected person, malaria infected person, again got a mosquito bite. So these gametocytes, they'll enter into gametocytes, it will enter into mosquito body. In mosquito body, it will form gamete, male and female gamete. Male and female gamete. So this is male gamete, this is female gamete, macrogametocyte and microgametocyte, flagellated, non-flagellated. So these macro and microgametocyte will fertilize in digestive tract of mosquito, in the digestive tract of mosquito, and then from digestive tract it will migrate to salivary gland of mosquito. So fertilization in digestive tract, fertilization in digestive tract of gut of mosquito. Is this clear? Everyone clear? Good, good, good. Yes, Lucky, doubt, you don't say doubt. Yes, type your doubt. Female Anopheles mosquito. Female Anopheles mosquito. Yes, Dhara Hasini is asking, so rabies is not species specific. Yes, rabies is also species specific. It never it happens to all animals. You will not get rabies in case of the dragonfly. You will not get in butterfly. Rabies only in case of the mammals. Only in case of mammals. So mammal is what? One group. I'm not saying here one species. Mammal is one species. Mammal is what? One group. So mainly it is found in, or it is the infection is found in the mammal. So it is not. Okay, everyone. Thrombocytopenia. Yes, we'll discuss all this stuff. Yes, dragon, Bacteria, all will discuss this in main class. Chalo, back to this again. Macrogametocytes and microgametocytes done. Okay, then you go to the zygote formation. Zygote formation done. Zygote formation, it will migrate to the salivary gland. Salivary gland. Please check it. Okay, you can note it down. I think done. So here, sorry, I said I think rabies is a bacterial disease. No, rabies is a viral disease. But yes, it is mainly in case of mammals, not in all. Chalo, macrophages, this is done. Oocyst stays. Oocyst means after fertilization, okay, it forms ookinete. No need to remember. Oocyst, it migrate out from, this whole structure is called oocyst. It migrate out from digestive tract. This is digestive tract. So when it comes out from digestive tract, it is migrating towards salivary gland. And again, it is ready for infection. Again, it will infect the second person. So I think here it is done. Malaria, two organisms are involved, two species or two organisms are involved. One is human, one is mosquito. One is human, one is mosquito. So mosquito to human, human to mosquito. So this parasite Plasmodium is called digenetic parasite. So you can note it down. Okay, Plasmodium is a digenetic parasite. Everyone done? Digenetic parasite. Plasmodium is a digenetic parasite. Digenetic parasite. It is done. Digenetic parasite. Very good. So in digenetic parasite, we use the term primary host and secondary host. Mosquito is what? Host. Human is what? Host. Okay, everyone. So you need to write mosquito body is primary host. Mosquito is primary host. Okay, and human is secondary host. Note it down. Note it down. Human secondary host for malaria, not for other diseases. Different diseases, different classification. Yes, for the malaria, human is secondary host. For the malaria, mosquito is primary host. Okay, this is done, everyone. Okay, here one more image you can see for Plasmodium infection. Same type of cycling, same type of explanation. Here you see, when mosquito bites, which stage it enters into human body? Sporozoid. Everyone, it will give you a clear-cut idea about infection. It enters into liver cell, hepatocytes. So this cycle is called exoerythrocytic cycle. Means it is not in RBC. That's called exoerythro. Exo means outside. Erythro means RBC. Exoerythrocytic cycle. And again it releases the what? Merozoites. Merozoites they enter into RBC. Here is RBC. So in RBC cycle again it releases the what? Gametocytes. Gametocytes again it enters into, hello everyone, it enters into mosquito body. Again, it enters into mosquito body. Mosquito body, again, it forms macrogamete and microgamete. Microgamete and macrogamete, it forms fertilized stage ookinete, ookinete, oocyst, oocyst, again sporozoid in salivary gland, and it is ready for again infection. Clear or not? Now you take this screenshot, please. Here you can take this screenshot of this whole complete. Screenshot done. Okay, done. So anyone, you want again explanation? Janvi, yes. It is same it is same last slide nothing extra I said here same this slide only this is simple, this one is more complex. Okay, this is simple mosquito body, this is human body. In mosquito body I'll start with sporozoid. Sporozoid enters into human body, okay, through mosquito bite. Mosquito bite, it gives the sporozoid infects liver cell releases merozoid infects RBC releases gametocytes after several cycle. In RBC only one toxin it is released, hemozoin, hemozoin causes fever. Remember this, go through NCRT, read NCRT, you'll get this word. Hemozoin causes fever. Okay, I'm repeating again and again here. So this is RBC. Okay, it releases the what? Gametocyte stage of Plasmodium. Gametocyte stays again with another bite or another a mosquito, female Anopheles, if biting that same infected person, yes, infected person, it will enter into mosquito body, again these stages it will be formed: macrogamete, microgamete, zygote means fertilized stage, then ookinete, oocyst, and further again sporozoid. Okay, you will get this part in your human health and disease chapter, human health and disease, class 12th NCRT. Okay, and here you'll get, everyone, here you'll get this one NCRT image also. I'll show you the wait. So this image does same, exactly same what I explained in last diagram. Okay, but the diagrams here well or more and more explain. Mosquito is going to be primary host, need to remember. Human is going to be secondary host, need to remember. Now I'll go for the few Helminth disease. Helminth disease, you know the Ascaris and Wuchereria. Ascaris, it is common that roundworm, and Wuchereria is also one type of roundworm. Here the short one is male, the long one is female. Okay, they belong to group. Which group? The Helminth, or they belong to Asci helminthis, roundworm. Roundworm animals. Two animals I said. Ascaris mentioned in your animal diversity chapter. Okay, Wuchereria, complete name is Wuchereria bancrofti or Wuchereria malai. Listen carefully. Ascaris and Wuchereria. Ascaris causes disease ascariasis. Which disease? Ascariasis. Intestine, large intestine, small intestine infection, mainly small intestine. Wuchereria causes filariasis or elephantiasis. Okay, so let's see these diseases. Yes, Wuchereria causes Wuchereriasis or filariasis. It is also called filarial worm. Okay, or elephantiasis. Elephant-like feet, titled swell. So here you can see again Ascaris lumbricoids, Ascaris in your intestine. So how it reaches, how it enters into your body. If you are playing, if small kids they are playing in soil, so in soil these parasites eggs are present. through nails, through the fingers, okay, it goes to food, and from food to your digestive tract, eggs. And these eggs, they grow in your intestine, in your lungs, and they cause their infection in your intestine, in your digestive tract. And these type of things are possible. Again, to kill them, to remove them from your body, what you'll do, okay, you'll take the medicines, okay, under the prescription of, you'll go to doctors will prescribe the certain medicines, and medicines are nothing but the albendazole. Albendazole is one of the medicine, deworm drugs. I think you know deworm drugs. Okay, so it is common in case of the young kids or the small babies. Clear? Now you go to the here. This is one type of helminth infection, loa eye worm. Okay, in eye you can see here the one worm infection, loa eye worm is also helminth infection. I'll not go in detail, just for your understanding. Loa eye worm. This is filariasis. What I said, filariasis, I'm going to explain again in detail. Human body, if it is getting the bite from infected mosquito. Which mosquito here again? Which mosquito bite? So it is again one pointer to note it down. Remember, which mosquito bite? Generally Culex mosquito, generally female Culex mosquito. Culex mosquito with L3 larval stage, or larval stage simply. Larval stage. Larval stage. Larval stage, it enters into human body and it grows in your lymphatics. It grows in your lymph vessels, just like blood vessels in your body. Lymph vessels are present. So in lymph vessels, and mainly lower lymph vessels, your body parts, lower side, it grows. And when it grows, these larvae, these worm larvae, it grows, of the adult it grows. Your lymph vessels, it swells, it goes to enlarged, and deformity to that organ, or your organs are deformed. Okay, so Culex mosquito. And here you can see the elephantiasis or filariasis or wucherariasis. Three names I said: wucherariasis or elephantiasis or filariasis. I think clear? Everyone clear? Okay. Good. Chalo. So this is what filariasis, filarial worm growing in lower limbs mainly. Lower limbs mainly. Here you can see the lower limbs it is growing. Lower limbs it is growing. Okay, this is filarial worm in blood. Okay, I think this is done. Okay, here are some tests we'll discuss in class, not here. Now I think we need to discuss little about ringworm. Here you can see one patchy ring-like structure. One patchy ring-like structure visible, everyone. Ringworm. So ringworm is due to ringworm infection is due to Microsporum epidermophyton Microsporum epidermophyton. Athlete's foot we are not discussing, we are discussing the ringworm. So yes, your doubts? Microsporum epidermophyton and trichophyton. Microsporum epidermophyton and trichophyton. This is done, everyone. Note it down. Ringworm. Ringworm is a fungal infection. It's a type of fungal infection. Note it down. Microsporum, Sporum, Epidermophyton and Trichophyton. Good. Any doubt? Ringworm spreads one place to another place, sir? No, not one place to another place. It is from one person to another person, not from one place to another place. It is sorry, just due to technical issues, it get disrupted. Now it is audible and visible. Everyone, still buffering? Recheck. Yes, it is okay or not? Yes, all okay. Okay, good. So yes, we discussed about ringworm. Ringworm scaly patch here. You can see it is due to Epidermophyton, Trichophyton, and Microsporum genus. Genus it is not species. Okay. In these genus or genera, whatever the species it is coming, it can cause ringworm. Why it is called ringworm? Exactly, it is not worm. It is fungal infection, and it infects to uppermost dry layer of skin. In tissue chapter, you have studied that epithelium. Epithelium, if it is dead uppermost layer, we are discussing dead uppermost layer, it is called a stratum corneum. Stratum corneum. And stratum corneum of our skin, if it is infected, so this type of condition will be there, and this patch, it will increase in size slowly with time, with the number of days. It will increase. It will increase means the hair radius. You can see this radius. Okay, after 2-3 days it will be here. After again 2-3 days it will be here. So that's why it's called ringworm. That's why it is called ringworm. It spreads, okay, in a ring like fashion. So that's why I call ringworm. So where it occurs, why it occurs? So it occurs mainly where the more and more sweaty areas are there, more and more moist areas are there in our body. Groin area, armpit area, okay, this neck lower region area, backside area, chin area in case of male, because due to beard there is chance of the moisture accumulation, groin area, and then wherever the moisture accumulation or moisture more and more chances are there, moist skin chances are there, dead and moist I'm saying. Okay, and then this ringworm, it spreads from person to person, from garment to garment. Suppose I'm wearing my old garment, not clean clothes. Okay, second day, next day, and I'm not cleaning my clothes on time. So fungal spores, they used to grow on things. Okay, and that same fungal spore will grow on my skin. And if I'm not maintaining personal hygiene, I'm not taking bath time to time. If anyone not taking bath time to time, not drying their clothes in the sunny condition or the open condition. So suppose you are drying your clothes in a soggy condition, not the open air condition, then on your cloth only spores will develop. Then from cloth it will develop on the body. So yes, that's why I said to clean clothes on time and properly with the. Suppose anyone is infected. Suppose someone is infected with the ringworm. What to do? Consult to skin doctor. Okay, or if skin doctors are not available quickly, suppose, then you can go with the antifungal ointments. Antifungal ointments, creams. Okay, what is antifungal ointment? You may have heard about ring guard or other that creams, lotions, or ointments for fungal. Yes, dermatologist, skin doctor, you can consult. So this is ringworm. Similar to ringworm, one more fungal infection is there, mainly in the in between finger areas. Those who are more and more busy, more and more working in watery condition, in them it is visible. It is found. Athlete's foot it is called. Generally possible in other people also, not only those who are in watery condition, they are working in water based area. Other also possible, but athlete foot is more and more seen in those who are doing supposed to cleaning work, supposed to barefoot they're cleaning, they're not wearing the rubber boots and they are cleaning in water area, suppose cleaning staffs. Okay, so yes, it is very common. So due to moist, dead cells are more and more, or the soft cells are more and more, and fungal infection in that area. Okay, how to cure it? Okay, just to consult, just to go to skin doctor. Sir, if we wear others' cloth, then also possible. If that second person is infected, better to not to exchange cloths. Okay, not to exchange others' cloth. Even if you are exchanging others' cloth, when you are exchanging, you are giving your cloth to someone. Yes, give the washed cloths, not dirty cloths. Okay, completely washed cloths. And when you are returning, suppose someone else cloth, then yes, wash it and then return it. And it will be better to avoid. It will be better to avoid anyone else cloth to wear, slippers to wear, okay, socks to wear, anyone's else towel to use, anyone's else hanky to use, anyone's else toothbrush to use. Yes, people sometimes they do. I'm not saying it is a regular practice, but yes, sometimes people they do, and it's an unhygienic practice. Okay, it will increase chances of disease. I think this is done. This is clear to you people. Ringworm, it is not worm. Remember, it is not worm. It is fungal infection. But yes, it spreads in a ring-like pattern fashion. That's why we call it ringworm. I think it is very, very clear to you people. Everyone clear? Here you can see a few more photographs related to ringworm. Can you see here the skin patches? These skin patches are the fungal infection, ringworm infection. And under microscope, how that microsporum or fungi it will look like this. Clear or not? Here you can see the fungal spores, hyphae, and about fungi you will discuss, you will study more in case of the botany lectures, botany classes. Okay, I think this is done. Yes, it's physically infected. Yes, from one person to another person. Yes, fungal spores are present in air, but you will not be infected if you are not in contact with that fungal spore for long duration. Suppose you are taking your bath okay, regularly. So fungal spore will not get time to grow on your skin. I think it is, yes, it is physically infected. Chalo, now little bit we'll discuss about cancer. This image for malaria you'll get in NCERT. This exact same image you'll get in NCERT for malaria. Same image, same image. Now go to the cancer. What do you mean by cancer? Why we call this disease as cancer? In Hindi it is called Kark Rog. Kark Rog, Rogam, I think you know, disease. So why it is called cancer? Why we use this sign? Anyone please? Please fast. Anyone? Increase of cells. Okay, it is zodiac sign. Swaroop Reddy. It is zodiac sign, but why? Question is why it is used here. Chalo, cancer, crabs. Cancer means the scientific name of the crab. Cancer is scientific name of crab. Why crab it is used as symbol in cancer? Exactly, crabs they crawl very fast and they escape. If suppose you are trying to catch any crab on seashore area, beach area, yes, they'll crawl very fast and they'll escape. Yes or no? They crawl and they hide. They crawl and they hide. They crawl and hide. The same property it is shown by these cancer cells. Cancer cells, they used to migrate. They used to hide in our body. They used to migrate in our body, and this migration is called metastasis. Metastasis. So first of all, I'll explain what is cancer. This is normal cell. These are normal cells here. These normal cells, They used to divide normally. Yes, they divide. Normal cells also they divide. They divide rapidly also. They divide slowly also according to requirement of body, according to our genetics, according to controlled genes. Yes, I'm saying yes, they divide rapidly also, slowly also, and sometimes they don't divide also. Means all it is according to requirement, need, body shape, size. Suppose these normal cells, they are dividing among these group of cells. One cell, this one cell division controlling gene among these cells, one cell, in one cell division controlling gene become mutated. Yes, gene mutated. Which gene? Cell division controlling gene. Cell division control gene mutated. If it is mutated, cell division, on shortcut I'm writing, okay, mutated. So normal gene is called, normal cell division controlling gene is called proto-oncogene. Proto-oncogene. Proto means first. Onco means cancer. Remember, onco means cancer. So it is not cancer. Proto-oncogene is normal. Remember, proto-oncogene is normal. It is normal. In this cell division control gene is, proto-oncogene is mutated to oncogene. It is mutated to now oncogene. Oncogene is cancerous gene or mutated gene. And this process is what? Mutation. Cancer gene or neoplastic transformation. This change is called neoplastic transformation. Now I'll write few more words. This mutated gene, this cell, here normal cell I'm writing, here the cancer gene, cancer cell I'm writing. This is also called, these cells are also called neoplastic cells. Neo means new, plastic means here formation capacity. So these cells are having deform, or you can say the new formation capacity. They'll not follow normal your gene language, your normal control language. They'll not listen, and they'll not listen means they'll divide, okay, without your control, without your genetic control. So if they'll divide rapidly, uncontrolled way, yes, normal cells, they divide in a controlled way. Neoplastic cells or cancer cells, they'll divide in a uncontrolled way. So here in this oncogenic transformation, and these cells, they're going to divide uncontrolled division. Uncontrolled division. Uncontrolled means here they are not under genetic control. They are not under genetic control. Everyone clear? So among them, these neoplastic cells, if they are confined, if they are at one position, they are not moving, they are not migrating. So if at one position, so they are called a benign tumor. Benign. And if they are migrating, they are spreading, they are moving in body, then they are called a malignant tumor. Benign, malignant. So two types of word I've written here. If they are having uncontrolled division and they are confined, they are situated at one position, they are called a benign tumor. Now these are called benign tumor. And if they are spreading, they are called malignant tumor. Okay. And malignant tumors are only cancer. Remember, these are only cancer. This is not cancer. Benign tumor is not cancer. What it is spreading, what it is migrating from one area. Suppose here I developed one cancer, or sorry, tumor, rapid division of cells I developed. Suppose it is spreading in my body. Here again developed, here again developed, here again developed. It is called cancer. Yes, cancer cells, malignant tumor cells, they migrate from one position or one organ to another organ. That's why they are dangerous. That's why they are dangerous. And this property only called metastasis. Metastasis. This property, malignant tumor cancer is called, malignant tumors property is called metastasis. I'll write here, next part I'll write here, no space. So you can take the screenshot. Everyone clear? You can take the screenshot. Everyone done? Yes, in some cases benign, it will change to malignant. Yes, in some cases, not all cases. Chalo. I think you know about, yes, more I'll explain about the cancer. Wait. I think you know about pullipiri. Pullipiri in Telugu it is called, in English it is called wart, W-A-R-T. Pullipiri wart, you know. There are cure, Russell, there is cure of cancer. Okay, I'll explain, just listen to me. Okay, if you are in hurry, you will not get answer. Please listen to me. So if I'm saying, what is wart? What word you have heard? Pullipiri. Yes, you have heard. So pullipiri is the what in English, and it is skin one projection. You can see it one small outgrowth of skin area. It is tumor. It is the neoplastic transformation. Yes, you can call it the benign tumor. So all warts are benign tumor. Example, I'm saying warts. Pullipiri. Okay, and if you don't know warts, okay, you can do Google search. You'll get the warts diagrams. So warts are not cancer. Warts are not cancer. They are benign tumors. They are benign tumors. But in some cases, the benign tumor it develops into malignant tumor. In some cases, okay, not all cases, but yes, and that is called malignant tumor cancer, metastasis. So I want to write the cancer cell properties. So allow me. Screenshot done. So I'll write cancer cell properties, please, fast. So this is done. Now cancer cell properties I'll write. In cancer cell is also called neoplastic cell. Cancer cell is, it shows metastasis. Metastasis is migration of cells. Which cells? Cancer cells. In cancer cells, tumor suppressor gene is inactive. Tumor suppressor gene is inactive. In cancer cell, you'll get, everyone, no contact inhibition. Normal cells, contact inhibition mechanism present. Okay, I'll explain what is contact inhibition. Don't worry. Okay, in tumor cells or cancer cells, tumor suppressor gene inactive, not working. Tumor suppressor gene is a healthy gene or okay gene. Tumor suppressor gene, it is inactive. That's why cancer. Then in tumor cell, sorry, you'll get what? Contact inhibition. This is one mechanism. Contact inhibition absent. contact inhibition mechanism absent. So what do you mean by contact inhibition? Normally, when body cells, they used to come in contact with other cells, so suppose this one is cancer cell. This one is cancer cell. So when it is in contact with other cell, okay, it will not follow that not to divide, it will divide. But normal cells, healthy cells, if they are in contact with other cells, okay, they will not divide. Okay, it will give sense, it will give the information that you are normal, okay, you are in contact with other cell, division not required in normal cell, I'm saying. And in case of cancer cell, even they are in contact with other cells, yes, they'll divide, and this is called contact inhibition absent. Remember, cancer cells, they'll not follow contact inhibition mechanism. Okay, there'll be absence of contact inhibition. So please note it down or take the screenshot of all these points. Now I'll tell you about a few photographs, diagrams of cancer cells or cancer. Okay, remember cancer treatment possible. Cancer treatment, it is the 3-step or 4-step process. Okay, one is the amputation, cut the cancer mass where cancer it is there, remove it. Okay, second how to remove cancer is the radiotherapy, radiation it is bombarded on cancer cells are killed, destroyed. Third is chemotherapy. With the help of specific chemicals, we destroy the cancer cells. And new therapy is immunotherapy. Immunotherapy is also used to kill cancer cells. Yes, many cases, yes, cancer treatment is successful. But in many cases, yes, during treatment only, the patients, they die. Due to lack of treatment, due to delay in treatment, due to late diagnosis. Okay, yes, death possible, high rate of death in case of cancer. Okay. So how cancer it is diagnosed, little bit about that I'll explain here. The types of cancer you can understand here. So you just go through my photographs, what I've kept here, collected here. Normal cells, cancer cells, they migrate, it is called metastasis. Okay, and these are types of cancer: brain carcinoma, gastric carcinoma, oral carcinoma, lung carcinoma, like this. All these are cancers, and these cancers, they come under 85% of total cancer. Okay, then you go to these are a few facts you can read, you can understand later on. These are just facts. Okay, then skin cancer here types you can see. Then these are bone cancers, muscle cancer, lymph cancer. They come under 1% of total cancer. Just go through. Here you can see bone cancer, one diagram you can understand. It is called osteosarcoma. Okay, lack of time, so just go through these words. Blood cancer, 2 types. Okay, these are blood cancer points. Oral cancer, lymph node cancer, blood cancer again, blood cancer, WBC increases, not RBC. Okay, and here these are the reasons what it causes cancer. You can read it later on. These are reasons what it causes cancer. These are the test for the cancer detection: MRI, CT scan, MRI brain images. Here you can see more brain tumor. Here this person healthy, after cancer, brain tumor, yes, you can see the face, same person. And here you can see that surgery scar mark. Okay, this is also one type of cancer. Again, same cancer. Okay, these are treatments of cancer. Leave it. Okay, have a nice day. We'll meet again in offline classes. Bye bye. Take care. Have a nice day.